what are the metabolic consequences? Number one is insulin resistance. It is the main metabolic consequence which a person is having, and that is called as insulin resistance. What is insulin resistance? Whenever normal amount of insulin, whenever normal amount of insulin is doing subnormal action, subnormal action is not appropriate. That is why insulin start increasing, called as hyperinsulinemia, to perform appropriate action. So insulin resistance, that receptors are not working properly. And what is the reason? Answer is again, it is the center to the metabolic syndrome, visceral obesity. There are two types of fat. One fat is below the skin, called as subcutaneous. That is not that bad. But the fat which is around the belly, okay, it is called as visceral fat. Okay, belly fat around the omentum, it is dangerous. Why? Because that will increase free fatty acid and impairs insulin signaling in the liver and muscle, leading to hyperinsulinemia and impaired glucose uptake that after certain years will be converted into type 2 diabetic person. He will be called as diabetic person now, because he's having diabetes mellitus. So insulin resistance is, you can say, it is happening prior to pre-diabetes and diabetes. So first a person will have insulin resistance, then he will have pre-diabetes, and then he's going to have diabetes. And what is the central cause? Central obesity. In the criteria also, number one is abdominal obesity. So body mass index is not a good criteria, because suppose there are two person, body mass index is utilizing weight and height. If both person are having same weight and same height, one is muscular, other is obese, both will have same BMI. So how can you differentiate between that? No, it is always abdominal obesity. Suppose your weight is 100, but you don't have abdominal obesity. You are overall, your weight is like that. You are 6 feet 2 inches, having 90 kg of weight, or 10, even 100 kg of weight. Okay, but you don't have abdominal fat. It is not that dangerous. But even if you are 50 kg of body weight, you are having, and belly is 44 inches or 42 inches or more than 102 centimeters, you can see here. Okay, this is not good, because this is increasing free fatty acid and damaging receptor. In biochemistry, you must have read how they damage it. I'm telling you just for your revision purpose. It causes serine or threonine phosphorylation of the receptor. Phosphorylation of the receptor. So normally when insulin comes, it causes phosphorylation at the level of tyrosine. It is normal. So normally whenever there is insulin, okay, it will cause activation of the phosphorylation of the tyrosine, and it will activate GLUT4. It will activate GLUT4 so that glucose enter inside the fat and skeletal muscle. Fat and skeletal muscle. This is normal. So normally, what is the role of insulin? We know that whenever there is glucose, it will release insulin. Insulin will cause phosphorylation of tyrosine. This will mobilize GLUT4 so that glucose enters inside fat, I mean adipocytes and skeletal muscle. So muscle will get a lot of glucose and they will work properly according to that. Okay. So insulin dependent GLUT is GLUT4. Rest all are independent. So glucose can enter in the fat cell and skeletal muscle only in the presence of insulin, because it will phosphorylate at the level of tyrosine. What abnormal happen in the person who is obese? It causes phosphorylation at the level of not tyrosine but serine and threonine. Lot of question can be asked from physiology, from biochemistry, from pathology, medicine, but this is the common concept everywhere. That is why we want to discuss physiology conceptually. Should not forget. So what is insulin resistance? When proper functioning of insulin is not because of the receptor. What is wrong with the receptor? Now, insulin is not phosphorylating at the level of tyrosine, but it is causing at the level of serine and threonine. Why? Because of central obesity or visceral obesity. So the most dangerous thing of being obese is insulin resistance. It will cause hyperinsulinemia and a lot of things are there. You will need in medicine a lot of things.